Again, my name is Joy, and I am so glad to be able to serve here on the mental health team. And if this is your first time, we want to welcome you. And if you've been here before, we're so glad that you're back. And today we have the incredible opportunity to hear the story from my friend Mike. So he's going to come up here in a little bit. And then you're going to hear from another one of my really dear friends, Marshall. And this has honestly been a dream for me for a while, for him to be able to come and share what he's going to share today. So I just want you to know that you can go ahead and get excited. Kay's going to tell you more about all of that later and officially introduce him, but just know that you're in for a treat. I also wanted to let you know, after Marshall presents, we're going to have some time where you can discuss around your table, and then we're also going to have a time of Q&A. So you'll see on the center of your tables, there are some little 3x5 cards. So if at any point throughout today you have a question, please go ahead and just write it down, and we would love to have those questions answered as much as possible later. And if we can't answer it in the moment, if you want to put your email address on there, we'll try to follow up with that as much as we can later as well and get you back the information if we can't do it live. And then if after you've written it on the card, if you just want to hold it up, Kathy from our team and some other team members are going to come around occasionally, and they'll pick up your questions and make sure they get submitted. The other thing that I wanted to tell you about is that in addition to getting really great mental health information at this time, we also really love to make this as an opportunity where we can talk about personal mental health tools that can help you in your journey. Whether you're a loved one or whether you're struggling with mental illness, we'd like to talk about just some tools of mental health that can be helpful in your journey. And I really love also that we get to tie it in with Scripture. So today, I'm going to do that part and share with you a little bit about a tool that I really love and share with you just some practical ways that I've implemented that in my own journey. So for anybody who was at church last week, you might have heard about a soul words list from Mylan and Kay Yurkovich. And another little spoiler, they're going to share next month, so you don't want to miss next month because they're going to talk amazing detail about relationships, and they're just incredible. But for anybody that, if you look on your table, there's some soul words lists. And type A people, I know you already printed out your own list because they mentioned it last week, and you went and you found it yourself. But for everybody else, we just wanted to provide that for you. And I'm going to share how this has been something that's been helpful to me in these last few days that has just kind of helped me get over a little bit of a mental health just challenge that kind of came up in my life. So I have been thinking a lot in this season of just what it means to be separated from people. And that's been a lot of what happened in COVID. But when I thought about it in my own personal life, honestly, for many years, I felt very separated from my emotions. Like I couldn't identify how I felt. And I know when I first started going to counseling, my counselors would ask me, like, how are you feeling? And I had nothing. I didn't know. I just couldn't identify how I felt. So I really loved it when I got the soul words list and a feelings list because it helped me to start to identify and start to get in touch with myself and see that, you know, this is actually something that can help me learn about what's going on inside of me. So that was really helpful because growing up, I thought feelings were either good or bad, and that I could only bring my good feelings like hope and joy and happiness to God. But any negative feelings were like the ones that were sad, like sadness and anger. All of those I felt like were not something that I could bring to God. But over time, I learned that feelings really aren't good or bad. They just are. And they're an opportunity to see what's going on inside of our worlds. And what we do with those feelings can be good or bad, but just the feelings in and of themselves can actually be really helpful. So this is how it's played out in my life. The last few days and weeks, I have just been realizing that there's been a lot of things going on, and I was feeling a lot of pressure. And I deal with this depression and eating disorders. And so sometimes those can kind of overlap and just get complicated. And there were some things that just kind of triggered the feelings of depression and just feel like thoughts of eating disorder stuff that just came back into my mind. And honestly, I was just kind of overwhelmed and caught off guard, and I didn't really know what to do with it. So I'm also part of Celebrate Recovery, and I have the opportunity to work my recovery, which I love. And part of that journey was, I talked to people about it, and I was like, this is what's going on. I don't exactly know how to figure it out, but this is where I'm at, and I just wanted it to not be stuck in my head. So I talked to some of my safe people about what was happening, and they were great, really encouraging. It was awesome conversations. I felt better, but I still kind of felt stuck. And so I was like, okay, I got to take this to God, and I got to work through this a little bit more. So what I did was I went to my feelings word list, and I was like, okay, what are my 3 emotions that I'm feeling? And I identified 2 of them were shame and fear. And the shame came in that I was struggling. And the fear came in that if I talked about it, that the people would leave me because I was not perfect. And so what I decided to do was like write out the process and just write out like, this is what happened, this is where I got stuck, these are the things that kind of happened, and this is what the shame and the fear are representing for me. And then I didn't want to just stop there with the feelings word list because that was very helpful, but I wanted to also tie that into scripture and see, okay, is this real? Like, what are the shame and fear representing? Well, they're representing abandonment, that I felt like if I was real about the fact that I was struggling, people were going to leave me. So what I decided to do was think about a passage that really has comforted me and helped me as I work through shame. So I'm going to ask that the verses be brought up from Romans chapter 8. And the first one that we're going to go to is the whole chapter of Romans 7 and 8. Those 2 chapters are incredible if you want to go back and read them later. But the ones that I'm going to start with are actually verse 35. And it says, "Can anything ever separate us from Christ's love? Does it mean he no longer loves us if we have trouble or calamity or are persecuted or hungry or destitute or in danger or threatened with death? No. Despite all these things, overwhelming victory is ours through Jesus Christ who loved us. And I am convinced that nothing can ever separate us from God's love, neither death nor life, neither angels nor demons, neither our fears about today nor our worries about tomorrow. Not even the powers of hell can separate us from God's love. No power in the sky above or in the earth below. Indeed, nothing in all creation will ever be able to separate us from the love of God that is revealed in Christ Jesus our Lord." Now, I don't know about you, but that was exactly what I needed to hear with the place that I was in. I was realizing that no matter what my feelings are, if they're at the best or if they're at the worst, I'm not going to be separated from God. Some of the translations say, in the depths. And I think about that as like, in the depths of my depression, I'm not going to be separated from God. And some of it talks about in the heights. And even when everything is working well and I feel like life is managing incredibly, even then I still need a Savior and I'm not going to be separated from God. So it doesn't matter if we're at the highest of our highs or if we're at the lowest of the lows, there's nothing that can ever separate us from God. I think about this a little bit if I was going to read it again and insert some things of mental health struggles. Say, I am convinced that nothing can separate us from God's love. Not depression or anxiety, not bipolar disorder, not schizophrenia, not substance use disorders, not self-harm. Nothing in all creation is going to be able to separate us from God's love. So as I think about this, I just don't know where you're at today with what you're feeling. And some of you can identify your feelings in a second, and others of you, it might take a little bit more time. But I do want to encourage you to take the feelings word list home and just take some time at some point today or tomorrow and just identify what are a few emotions. If there's a time where you get stuck and you're like, okay, I don't know how to work through this, identify what a few of those emotions are, and then pray about it. Go back to Romans 8 and see how really, no matter what you are walking through, it's not going to separate you from God's love. I also just wanted to take a moment to pray for us. And if at any time you need prayer throughout today, we have an incredible prayer team in the back. You don't have to wait till the end. If something comes up in the middle and you just need somebody to pray for you, please know that that's what we're here for. And I just want to, just take a moment so we can pray. God, I just want to thank you so much that we can bring all of our hurt and our pain and our shame to you. God, you promised that you cover it all. and there's nothing that can separate us from your love. I just am so grateful that in the midst of all of the challenges that we're facing in our world, God, you not only know each person in this room, but you made us. You knew the challenges that we would face, and you promised that you would always be with us. God, I pray that right now, even in this moment, each person will just be able to let down a little bit of the barrier of where they're at, that they'll be able to identify what they're struggling with or what their fears are, God. And I just pray that in this moment, they'll feel your love for them. If anybody is feeling like they've gone too far or you couldn't love them because of the way they're struggling or even some of the actions that they've done, God, I just pray that you will help each person to continually know that they are safe in your love. God, as we bring our feelings back to you, I pray that you'll help us to see that nothing can separate us from you. Thank you so much that we get to be together today. In your name, amen. And at this time, I'd like to go ahead and welcome my dear friend, Mike. He is an incredible, incredible friend, and I'm so excited for you guys to get to hear his story.
Hi, my name is Mike Brook, and I have had the privilege of being the college pastor here at Saddleback for the last 9 years, and I'm so glad to be with you and to be able to share my story with you today. I grew up in a pretty normal home. I was a pretty normal kid growing up. I loved baseball. I was raised watching comedies and learning to laugh, and I had a pretty great family. In junior high, I struggled to fit in and couldn't find my place, but in high school, I really seemed to figure it out my freshman year. I moved in from a small school that had, from kindergarten through 8th grade, only 200 students to a freshman class that it was about 1,500 students and a school of 5,500 students. And I got plugged in pretty quick thanks to some friends that I made on the football team and thankful for a neighbor that brought me into a youth group when I was young. And I played football and baseball and skateboarded and got in some trouble, but everything I wished for in junior high, I found in high school. I fit in and I seemed happy. And I don't know when it was, sophomore, junior, senior year, but sometime in high school, something shifted in me and the first signs of my depression began to show. I would go to school, I would act normal and laugh and make people laugh around me, and I'd go home and just feel horrible. I couldn't say why. There wasn't a breakup. I had friends, I had a job, and my senior year, I even found Jesus and had him in my life. And at 22, I finally went to the doctor after some major pushing from my mom. After several appointments and tests, I was diagnosed bipolar, type 2. And my first thought that I had when the doctor said those words was, how embarrassing. It caused me to hide, to not talk about it. And eventually, after a short time of finally figuring it out and finding stability on medication, I stopped taking them, hoping that I was all better and it had all gone away. From 22 for the next 10 years, I kind of rode the waves until I hit another rough patch about 10 years ago, and I couldn't get past it. My wife pushed me to talk to the doctor about it, and I was reluctant to go. I didn't want to hear the words again. And when I heard the diagnosis again from the doctor, it was just as devastating as the first time I heard him. I went and decided immediately I needed a second opinion, so I went to another psychiatrist, and she said the exact same words, and I was embarrassed, nervous what people would think. I didn't even know what I thought, and that was quickly followed with guilt and shame. And the doctor reassured me it was just like having any other disease. It's like having diabetes, and with medication, we can find stability, and we can get things under control, and that was great news, but I just didn't know how it would work. I only knew one person growing up that admitted to having mental illness, and I remember hearing the whispers about him throughout the neighborhood. I didn't want that for me. I felt so alone, like I was surrounded in this pool of people that loved and cared, but I was drowning in my sadness, in my depression at times. I didn't know one other person, one friend, one leader, one pastor that was going through something similar to me, so I hid. I kept it to myself. And for the first several years in ministry, it's what kept me from moving forward into God's calling, was my mental illness. It was how Satan attacked me. He wanted me to feel like I was alone, that I wasn't qualified to lead, that my illness defined me as a person and as a Jesus follower. And my defining moment was the first time I ever decided to share it with a group of people. It was freeing. I went in nervous and scared, prepared to be rejected, but I found freedom. Several people came up after me and said that they were going through some similar things. many of which I knew the person, but I didn't know any of the struggles they had been going through and facing. Through that, God showed me that there is hope, even if I'm not healed this side of heaven, because when I allow him, God will work good out of all things for those who love him and are called according to his purpose. And I'm getting to see the good coming out of it as he's placing more and more people in my life that have similar battles that I do. I've had the privilege, as Paul talked about in the scriptures, of seeing my weakness become a strength by the power of the Holy Spirit. So if you're hurting, depressed, battle anxiety, bipolar, ADD, or any other disease that is out there, I want you to know you are not alone and that God loves you and has an unbelievable plan for your life. I sit here with you today because God is stronger than my disease. I thank God every day for the doctors that could diagnose mental illnesses, for the medications that we have at our disposal to treat it, and for the community that I have found in the church and in my small group. But God created us to be something unique and special. If you're struggling alone, I would tell you that there are more people who care about you than you would think, but you have to be willing to open up. You have to be willing to talk about it and to allow a community to come alongside you and to minister to you. Find a friend, a pastor, someone that can bring you in and tell them what is going on. Ecclesiastes 4:12 has been a verse that has really impacted me as I look for my team, my people, the ones that were going to journey with me over the rest of my life. Ecclesiastes 4:12 says, "Though one may be overpowered, two can defend themselves, and a cord of 3 strands is not quickly broken." See, I have found victory begins when we open up and share what is going on, because it's then that you stop allowing yourself to be defined by what you feel, what you think, or what others think, and begin to be defined by what our great God knows about you, that he created you. He knows you by name, that he knit you together in your mother's womb. He has your name carved on the palm of his hand. He cares for you and has an immense love for you that is best felt in community. He has a great plan for your life to give you a hope and a future. Things aren't always perfect in my life and probably will never be perfect. I still see a psychiatrist every few months. I still go to therapy every month, but I'm seeing God shine through by reminding me I'm not alone, that he is there with me, my church is there with me, my friends are there with me, my community is there with me. I hope today you leave encouraged, that you come to see you are unique and loved by the God of the universe, and that you find a community here that cares and will journey with you. Thank you so much for letting me share my story.
Hi, everyone. I hate to interrupt your great conversation. We're going to give you a chance to talk again in a little bit after you hear from our speaker today, who is Marshall Moncrief. And Marshall doesn't like long bios, so I won't give you the long bio, but I just want to just tell you more on the relational part. I met Marshall in 2017 with a group of other leaders in Orange County who were interested in doing something different about mental health care here in Orange County, who set some very big goals and some kind of, out of this world type goals for Orange County. And so I've known Marshall since 2017. We'll talk more about that, but let me just tell you, he is the Chief Executive Officer of Be Well Orange County. He's a licensed therapist and holds an executive MBA in healthcare management. Prior to his current role with Be Well Orange County, Marshall served as the executive, clinical, and administrative leader of mental health and addiction services for the Hoag Health and Providence St. Joseph Health Systems. So like I said, I've known him since 2017, and he is an excellent speaker and leader and thought leader and compassionate person. And I think I'd probably say the 2 things about Marshall that strike me the most and really make me the most excited for you to get to hear him is that Marshall is, he has a compassionate heart. He's a skilled presenter, and you're going to hear a skilled presenter. But even more than that, he is a very compassionate man and an amazing human being. So would you please welcome Marshall Moncrief?
Okay. Good. So, Mental Health Awareness Month, bringing attention to mental health disorders and substance use disorders. But a super important aspect of that is also highlighting the courage from and through the people that live with these challenges. Some of you might be in the room, and the families that surround them and support them, and the communities that embrace together these challenges. And so I was sitting and listening to Joy so beautifully and courageously share your own journey, so thank you for that. And also kind of sitting witness to all of you as community who are here together to embrace that story and embrace Mike's story. And that's what this month is all about, is that if we can do this with mental health disorders and the way we've done other healthcare disorders and bring them to the forefront and talk courageously about our experiences in community and receive each other with those stories, then we're going to move the dial. And that's what's happening in this room today. And I really appreciate Saddleback Church, Joy and Kay, allowing me to join you all and be a part of this. So thank you, and thanks for being here. So we did listen to Joy and Mike talk a bit about personal experiences, and that's a super essential part of this Mental Health Awareness Month, is talking about those individual challenges, the community I just talked about. Another piece, though, that we're going to talk about today is the system that's available to address these challenges. And so in Orange County, California, we have the best health care of just about anywhere on the planet. And so we have extraordinary healthcare systems that can address just about anything under the sun. And so if you are going to have a stroke, God forbid, you want to have that in Orange County, California, because we have a world-class stroke system. We really do. And we didn't about 20 years ago, but we built one and we created one, and it's extraordinary. If you're going to have a heart attack or you're going to find yourself with a cancer diagnosis, you want that to happen in Orange County, California, because you have immediate access to world-class care. And you will be guided through a system that's going to take care of you every step of the way. If you have a mental health disorder or a substance use disorder, and you have one of those in Orange County, California, it's fine if you're here, but you might as well be in the middle of the Sahara Desert too, from a system perspective, because there isn't one. That doesn't mean there's nothing happening. There's good things happening, a lot of good things happening. There's a whole bunch of services. There's a whole bunch of clinicians. There's some awesome programs. There's some faith community stuff like this that's just amazing. But there hasn't been a coordinated system for mental health care that captures you in, no matter what stage of a process you're in. Acute illness, kind of at the early phases, somewhere in recovery. There hasn't been a system to capture that and hug you in the way that we have for the rest of healthcare. So the story that I want to talk to you about today is an effort in Orange County where a few of us are naive enough to think that we might be able to pull that off if we come together like this and build that system in the same way that we did for stroke care not that long ago. So I'm going to tell you the story about Be Well Orange County. I'm really honored to be up here and be the person telling you this story, but there's a whole bunch of people that could just as well be up here telling you this story, because this is not a story of one organization and definitely not one person. It's a story of community coming together to pull this thing off. And what we're about is creating a world-class system of mental health care, just like we have for all other diagnoses and health issues in Orange County. So Be Well is a public-private effort. We've got about 400 plus organizations that are actively participating now, and a few thousand people. And it's representative of the public health system that channels through the county and some cities, and CalOptima, the Medicaid health plan. All of the not-for-profit hospitals are at the table. The big universities are at the table: Cal State Fullerton, UCI, Chapman. The faith community is at the table. Thank you, Kay, for your leadership from day one, and Joy and the whole team. And a whole bunch of other faith organizations and community are stepping in. And everyone is coming together to build this transformational system of care. Oh, I forgot I had this question in here. So I wanted to keep you on your toes, and so I wove in some multiple choice questions. And so here's your first one. So through the eyes and experience of the residents of Orange County, which best describes the system of mental health care in Orange County? I really should have had this on the front end, because I sort of gave you the answer. It is D. It is D. So it is definitely fragmented, and I hear all these other things kind of on a daily basis from folks. I tell you, I get calls every day on my cell phone from people that need support. In fact, walking in, I was in my car for about 10 minutes responding to 2 families that needed support. Interestingly, both families that were asking me for support, both of them are senior executives of the biggest healthcare systems in Orange County. Yeah. Well, that's it. I mean, yeah, we have to laugh a little bit or else you just sob. And so, so we have a long way to go. Because I'm not making it up. 2 of the biggest healthcare systems, top execs, their children, adult children, struggling with mental health disorders, they don't know where to go. And they might as well be in the middle of the desert. So the left-hand side is what the system looks like and feels like to a lot of us. And so all the little drifty flags they're probably hard to read, so pardon me for that, but basically they represent the different sectors of the community. And so you've got a little flag up there that represents the justice system, another one that represents the faith community, the little cross is the hospitals, academia is up there, housing. And so in my role, it's sort of an unusual role, I talk to senior leaders in all of those sectors. And if you were to talk to somebody in academia, whether it's a public elementary school where my wife works, or Cal State Fullerton, where I ended my last meeting on Friday, and you were to ask anyone in the school system, hey, what are your top 3 problems? Among the top 3 is mental health and substance use, to be sure. If you were to ask Kay or Rick, hey, pretty big church, what do you think, what's your top 3 problems among your congregation? Mental health is gonna come up, for sure. Talk to a physician, it doesn't matter if they're in the ER or primary care, same answer, and you kind of get the story. Talk to a chief of police or a boots on the ground law enforcement person, same answer. So all of these sectors are increasingly impacted by need, and all of them are struggling to solve through it through the unique lens and oftentimes limited resources of that specific sector, or even more limited, their singular organization. So a lot of good work, a lot of hard work, but it's fragmented. So it ends up being like little acupuncture pokes instead of one big collective, let's do it. Amidst the fragmentation are the people that struggle. And so you see the little stick figure people. Some of them are insured, some of them are not insured. For those that are insured, some are publicly insured through CalOptima, some have private insurance. Doesn't matter their insurance, they have different clinical needs, mild, moderate to severe. And all of those categories create 1,000 different doors, and you've got to find the right key to get in the right door to get the right care. And so right now, today, somebody is calling Hoag, where I worked for a long time, and we have an outstanding addiction treatment program there, and someone's calling in right now and saying, I really need to get in to care for my addiction problem. And they're being told, gosh, I'm so sorry, it looks like you have Medi-Cal and we don't have a Medi-Cal contract, so you have to go across town to this other spot. And they're gonna go across town and they're gonna find a Medi-Cal provider. Thank God I found you, I just across town trying to get into Hoag and I couldn't. Well, gosh, I'm sorry, we do take your Medi-Cal, but we only treat your mental health disorder. You have a substance use disorder. So you actually have to go another cross town, ... And some of you are nodding your head as if you might have lived some of that, because it happens every day. And that's the fragmentation we're talking about. And because of that fragmentation, the crises in this community are increasing. We've engineered a system where law enforcement and EMS are the default response. And when you have that as your default response, then the default destination is a hospital or a jail. That is not a criticism on law enforcement or EMS, and we're going to talk about those wonderful people in just a minute. That's a commentary on the way we have a non-system, and so we've engineered a situation for poor outcomes and repeated poor outcomes. So what are we doing about it? Oh, these are going to catch me just like they do you. Okay. So annual emergency department visits. So the last job, I oversaw 7 hospitals in Orange County from the perspective of mental health, which included activity in the emergency departments. And so it was my job to know some of these statistics. Every year in Orange County, the annual emergency department admissions across our hospitals for mental health and substance use disorders. Take a crack at it. It is D. Don't get lazy though. They're not all going to be D. So 50,000. So that's true. It is 50,000. That's a lot of people going into the wrong care for the wrong reason, getting the wrong treatment, and not having a great outcome. And so I worked really closely with emergency department teams for a really long time. And I can tell you there may not be any better humans on the planet than those guys. They give 1,000% every second of every day. And they will be the first to tell you, we don't have the training, we don't have the resources, and this is not the right environment. They want to help, and they're constantly frustrated. But that environment is antithetical to what somebody in a crisis needs to experience. And yet we're doing it 50,000 times a year in Orange County. If it doesn't strike the heart chord that it's the wrong care and the wrong environment, and you're more of a financial person, imagine the average emergency department admission is about $2,000. Why? Because we're regulated to do all this stuff. If you walk in, we don't have a choice not to do all these workups. So it gets pricey quick. So to do the math, and I won't test you on this one, I feel like that'd be cruel. 2,000 times 50,000 is 100 million. That's the spend that you're all sharing in every year for poor access and poor outcomes. In Orange County, in 2022, as you sit here right now. So this isn't a historical. This is a we're in it. So we've got to do better than that, is the point. And we're going to do better than that. So what Orange County is aiming to do right now as a unified community is take that fragmentation, take all of these sectors in the community, all of us, and create a unified ecosystem of support that wraps a hug around all of Orange County, regardless of if you're insured, uninsured, and what your clinical need might be. So that's the story of Be Well Orange County. It's really tricky to do, it turns out. But that's the goal, and that's the vision. And so Kay, Sheriff Barnes, Rabbi Rick Steinberg, Fram Vergy from Cal State Fullerton, Goldstein from UCI, Robert Braithwaite, the head of Hoag, all of these people, all of these leaders across all of these sectors, the new CEO of Cal Optima, the Medicaid health plan, they all are channeling together to try to make that a reality in Orange County. So that's our vision. Create a unified system of mental health that wraps hug of support around everybody. The way we think we get there is this super simplified little blueprint. And so we asked ourselves, this goes back to 2017 when we were first connected, if we had a world-class system of mental health care in Orange County, and if we were all rowing the same direction to get that done, what would be the results of that system? Where would we be moving the needle if we had a world-class system of mental health care? And we said we'd be moving the needle in 6 primary areas. Upstream in stigma reduction. So can we create an environment where everybody across the community is talking as openly as Saddleback Church is about mental health disorders, as courageously as Joy did? If we're all doing that, that's a game changer. So we need to move the needle in stigma reduction. Prevention and early intervention. And so at our table, one of the topics that came up was attachment and early childhood attachment with parents and family and community, and the way in which that sets a stage for mental health challenges or resiliency. And so prevention and early intervention are a huge one. Closing the treatment gaps is number 3 over here, and I'm just moving around the clock. Strengthen the crisis response system. So we've got a couple of upstream areas, and then we've got a couple of more downstream areas when crises are happening. So close the treatment gaps and strengthen the crisis response system. And then established campuses of care. So I gave you the example of Hoag, who I love, and I spent a lot of time there, of that patient calling today who has Medicaid and can't get in. So we need care facilities that have comprehensive mental health treatment and comprehensive addiction treatment that are agnostic to the insurance card you have in your wallet. No insurance, we're gonna hug you in. Medi-Cal, we're gonna hug you in. Some weird Blue Cross PPO plan, we're gonna hug you in. I mean, it's like that's the thing. You go to care, and the first thing that happens is a wallet biopsy. It's like, all right, let's see. Nope, 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 nope. So we have to fix that. And so that's a goal. And then the sixth one is aligning partners and programs. And an example of that is there's a whole ambitious effort around homeless solutions in Orange County. Sometimes it feels like there isn't an ambitious effort because the problem is so big, but there's a lot of people working really hard on it. And so an example of that sixth result would be we've got to align what we're trying to accomplish in mental health with what we're trying to accomplish in homeless services solutions. Not because everybody who's homeless has a mental illness and everyone who has a mental illness is homeless, but the overlap between those two you can't ignore. And so you're not going to really succeed in one without the other. That's that. So those are the 6 result areas. And the little gray dots surrounding each of the 6 represent the community entities and people that are doing really extraordinary work in those areas today, currently. And what we're saying is, keep doing what you're doing, but can we rally together around certain targeted areas in each of these 6 and measure the impact? And so right now, those 400 plus organizations I told you about do have active initiatives in each of those 6 areas. And it's pretty incredible. I'm going to tell you about 2 today. So we're doing that. And then we put together a little nonprofit organization that sits at the center of that to try to coordinate all this activity. Express some really concrete expressions. So let me back up. That's the goal. That's the how we bring everybody together and organize it. And out of these areas, there are a few activities that are really concrete infrastructure. We need a health system infrastructure that we don't have today. And this is what that infrastructure really looks like. We need a navigation system. I'm going to walk you through what each of these things are. That link to a mobile response system, that link to these campuses of care, all 3 of which are supported by a creative network of providers. Now, to me, that's the language that I speak every day. To you, that might have sounded like a big bunch of gobbledygook. What that actually means is, on navigation first, in Orange County, we have 18 different phone lines, and it continues to grow, for things that are mental health needs and social services needs. 18 different lines. Because we have 18 different lines, nobody knows who to call for when or what. And so you call 911 because somebody's going to answer the phone and someone's going to respond. It isn't about we don't need those 18 different organizations doing the work that we're doing, but can we bring them together in a way that they currently aren't? So every day of my life, I arrive to my home, and in front of my door is a package, and it says Amazon on it. And it's because Jeff Bezos figured out this beautiful thing to take 100,000 different organizations and put it under one front door. And so it doesn't matter if my wife and daughter want shoelaces or a couch, you push the button and it shows up. And so there it is on the doorstep every day. So can we have the 18 lines doing exactly what they do best, but unify them under some digital access point that allows you and me not have to decipher our own challenge to know who to call, but just hit that button and get access to somebody that says, oh, you need a therapist for your child. I'm going to route you the direction you're ultimately going to go and get that. Oh, it sounds like you're in a crisis. We're going to get you here. So there's a lot of people working on that. It's complicated, and it has still every reason to succeed. If we did that, we would be able to identify where the problems are in the community, how we're distributing our resources to address those problems, and we'd get really smart and really efficient about how to do it. Right now, we're losing all sorts of information because the 18 lines don't share with each other. We're innovating in Be Well in Orange County, but we're also emulating shamelessly wherever something is working well. One area where this is working well is in Maricopa County, Arizona, which happens to be about the same size as us. So we've been out there about a dozen times now. They do this really well. And because they do this really well, they can answer the phone for any of us calling within about 5 seconds. Within about 60 seconds, they've understood enough to get you channeled to the right thing. And about 70% of the time, they're stabilizing problems coming in by way of these good resource connections. It's pretty extraordinary. So if we did that, we would have some similar result in Orange County. There are still going to be crises in community that you can't solve with a phone call. Somebody has to get out to the community. Like we just dealt with yesterday, there was a young man in Anaheim who was psychotic in the street. And so somebody's got to get out there to help that person. Instead of law enforcement or EMS, we can send a mobile program that's designed for mental health services to go address that problem. If we have just those two things right there, we will solve almost 85% of the crises in community without having to go to an emergency department or a jail. For the very few who would still need facility-based care, then let's build the campuses I was talking about where you have comprehensive mental health and addiction treatment that's blind to the insurance status of the individual. And so we have now built one. It's in the city of Orange, and that's the first of several. So I think the last time we were here talking, we were talking about, hey, we want to do some of these things. Well, we've now done the first one of the campuses, so I get to report to you on that, and we've made progress on this mobile thing. So yeah, it's totally cool. Thank you so much, and I just want to remind you of something. So I'm so happy and gracious to receive that applause from you, and I'm going to share it with about 300 people that made that happen and worked super hard to make that happen, because it is the whole community coming together to make some of this stuff happen. So what this looks like, we'll go to mobile response. So I'm going to talk to you about the mobile response and the campuses. So mobile response. So this is an in-community support for all residents. I'm reading the words because I don't know how well you can read them back there. For all residents experiencing nonviolent, non-criminal, non-emergency mental health and substance use related crises. This whole program is designed to support law enforcement. It's designed to support our paramedics and EMS teams. It's designed to complement the county's existing services and support the community that needs this help. We're deploying it at a local level, and it really is an expression of health equity. Some of you guys may have heard that term. Usually it's pretty academic, but this is the real thing in terms of being by, of, and for a community. So the way this program works, currently, I live in Huntington Beach, and currently, if there is a crisis that's mental health or substance use related in Huntington Beach, me and my neighbors and friends call 911 or the local police department. This is in Lake Forest. You would do the same thing, and here that call would get dispatched to Sheriff Barnes. But in my city, you call 911, it goes to a dispatch person sitting at a desk that looks like that, and that person has 3 tools: a fire truck, a police car, or an ambulance. Those are the 3 tools they have to deploy. And when you send those tools out, they have a couple of tools they can use. And so I have law enforcement guys tell me all the time, Marshall, we can do one of 3 things. We can take someone to a hospital, take them to a jail, or walk away. That's what we've got. And kind of the same thing with EMS. So what this mobile program is doing is giving a 4th tool to those teams to go out into community. So this 4th tool, this gets a little bit wonky, but I'm going to tell you about it. This 4th tool goes out instead of law enforcement and EMS to deal with these crises. It's manned by 2 crisis counselors, and we're there to deal with substance use problems or mental health problems or welfare checks or what have you. And it complements all of the existing mental health programs that are out there now. So some of you guys have dealt with the CAT team, the centralized assessment team from the county. The CAT team has a really important job. The CAT team goes out and assesses for 5150 holds. Those are involuntary holds. That's what they do. But that's all they do. And so when they arrive to a home and they assess the situation, which you called because it was a crisis in your living room with your 20-year-old son or daughter having their first psychiatric break, and the CAT team determines this isn't criteria to put this person on a hold. Have a good day. You're in crisis still. Where are you going? What do you mean? And so, it's pretty unsettling. And so this service is about trying to solve for the situation in front of them. The very first call that we got was a mom who was calling this. The first city that we deployed this in is Huntington Beach. And a mom was calling law enforcement multiple times a week, multiple weeks in a row, for her 12-year-old son who was kicking holes in the drywall and acting out. And the law enforcement team was incredibly compassionate, went out every time, took time to settle the situation down, and then would leave, and the call would come in the next day. So this was the first call that our team got asked to go out to instead of law enforcement, and spent time with the mom, spent time with the son, and they were there for about an hour. Law enforcement was there going out for about 10 minutes and leaving. No criticism to that. They have other things they need to do. This young boy, his dad died a year prior, and mom was dating all of these rough around the edges biker guys, and it wasn't going well. And so in a short time, we created a relationship with the boy, got him connected to counseling, got mom connected to counseling and parenting classes, no more calls from the family, and we continue to follow up, and they're doing really well. And so, yeah, it's just this poignant little thing. There was a young lady who was struggling with a bipolar disorder. Mike was sharing with us about that diagnosis. She was struggling with bipolar disorder, and the team went out and transported her to the Be Well facility in this case. Most often we don't transfer, but brought her to the Be Well facility with mom in the van. There's no other thing that can do that today. And so the girl was willing to go because she had the comfort of mom riding along with her. She got to the facility. She decided she didn't want to be there. She was too anxious. She was not holdable, so she left and went back home. Same problems erupted. So we went out the next day and got mom in the van and took her again. And it took 2 times, but this time she stayed, and she had a sense of trust with this team that allowed her to be receptive to that. And so it's not rocket science, and it's not super complicated. It's just compassionate, and it's just the right response for that moment. And it's making a whole lot of difference. So I won't walk you through just exhausting numbers, but the average response time is 14 minutes. This is looking at Huntington Beach and Garden Grove. We're now live in Anaheim and Irvine and Newport Beach, and it continues to scale along. But that's a really fast response time compared to multiple hours for the existing service that's assessing for a 5150. And the time on scene, about 45 minutes, but it'll be as long as it needs to. These are just averages. The statistic that I'm most happy about, and I'm sorry to show you boring data, we won't stay too long, but 85% of the calls are stabilized in community, meaning we're not taking them to a facility, because that's not the goal. We have the cool blue van, and it's really wonderfully outfitted so that when you do have to transport someone, it's incredibly compassionate and dignified and comfortable, but that's not the goal. So 85% of the time, we're meeting people where they are, settling the crisis down and getting them connected to care, following up to make sure they connected to care, and resolving the issue. And that's new and needs to be there. So here's a little test. So the award for the highest volume of calls for service goes to which population? So So it is D. So you can kind of get lazy here. I did all of them as D. I'm just going to tell you. So it's been fascinating for us to see the data come through that it's almost split in half. 50% of the calls we respond to are people struggling with homelessness, and 50% of the calls we respond to are in your living room or in your place of business or at your church or at your school. And so this really is a service for everybody. So sometimes we're driving down the street, looks like that, and sometimes we are at the park dealing with somebody who's living there right now. Most don't involve transportation. That's not the goal. But for those that do, where do you go? Where do you take them? And so the Orange campus is the first Be Well campus in this system that we're imagining and building together. It now exists, it looks like that, and it's in the city of Orange. And so I just want to be clear, where do you transport people? Not always do we transport here to Be Well. That isn't the goal either. But we do need comprehensive campuses like this to transport people to. And I'm going to tell you about this first campus. This is a first of its kind in the state of California and maybe beyond because of the partnership that came together to make it happen. And so I'm going to show you a whole list of health systems that came together to do this. So the Orange County Healthcare Agency led the charge. Kudos to them for that. CalOptima, Providence, Kaiser, Memorial Care, Hoag. Now on the second one, Chalk and UCI are stepping in. The cool thing about that for a healthcare geek like me is there has been nothing else in healthcare ever where these competitive entities have come together to partner to do anything. And so, I mean, you can't get Providence and Hoag in a room right now without bloodshed. So it really is an extraordinary feat because they're coming together to say this problem is too big, the opportunity is too awesome for us not to do it together. Okay, I'm getting a little heavy on the tests here. I think this is the last one. So, like a family working through home renovation, the partners of this project only experience a profound sense of love and mutual understanding. That's B. And so it's hard. It's really hard to get this collaboration going because there's lots of different agendas and there's lots of different regulatory realities, especially in private healthcare versus maybe the county's healthcare system. But everybody is working really hard to get through that because we know if we're going to create that beautiful, cohesive ecosystem I showed you that wraps support around all of Orange County, we've got to do it together. And so we are aiming to do that. Here's what the campus includes. There's 7 different services. I know you only see 6 boxes, but that one's split into 2. There's 7 different services, a full continuum of substance use care and a full continuum of mental health care. And so we have on the front end, this single story part of the building is kind of like an urgent care. And there's a Sally port there with a little roll-up garage that was designed specifically for law enforcement and EMS entities to pull into. And so that's the county's first sobering station. So when someone's intoxicated, instead of taking them to an ER or a jail, take them there and we can actually wrap support around them and hopefully have a better opportunity than those other environments of getting them up into a detox. And most of the time we can stabilize people in those 2 levels of care. But if you can't, then we walk them across to the residential program. Same thing with mental health. We have a crisis stabilization unit for mental health and the county's first adolescent unit for mental health. And so prior to this, if you were an adolescent in psychiatric crisis, the only place you could go is an ER. Well, now you have this environment, which is much more comfortable. And hopefully we stabilize you there, get you back home into outpatient. If you need more care, we'll take you up into crisis residential, which is about 2 weeks, get you stabilized there and back home into outpatient. And if you need more, over to the longer-term residential. So the whole thing works as a system in and of itself, and there's no other place in Orange County like that. And the most unique characteristic of this is highlighted by the first 3 patients that came in. So the very first patient was in need of the sobering center. We were open for 2 days, and I got a call from Judge Carter. Some of you have read about Judge Carter in the paper. He's an old Marine and a federal judge. And he called me on day 2, and it was about 6 in the morning. Marshall, hey, I want to see the new campus. Oh, Judge, you got it. Just tell me when, and I'll meet you over there. I'll see you in 30 minutes. Okay. So I jump in the car, and I race over there, and he's waiting with a cup of coffee outside the front. And I tour him through the campus, and we're outside by this white car at the entryway. And I'm waving goodbye to Judge Carter when up through the parking lot walks this guy who's staggering and looks to be homeless. He's incredibly disheveled. And I found out later that he was at UCI's ER, which is right up the road, and left against medical advice and was stammering through the streets. By the way, that happens dozens and dozens of times all day long at all ERs. So he's stammering through the parking lot here, and I got to wrap my arm around him and bring him in to care as the first patient, with Judge Carter standing there. It was really kind of extraordinary. The second patient, so no insurance, adult male, alcohol. The second patient was a 14-year-old girl on Medicaid in another ER for suicidal ideation. And we had already trained that ER, medically cleared her, got her transferred over here to this unit, and got her stabilized and back home and to outpatient treatment without ever having to go inpatient. And the third patient, was also in an ER, and he was 22 with commercial insurance, having his first psychotic break with his mom there. Got him transferred over, and when he got there, the first thing he said was, "Oh my gosh, I think I could breathe." So in the middle of his first psychotic break, he knew the difference between the emergency department environment and this, and got him stabilized, and he went up into the residential program. What that means to me is you've got 3 people across 3 different age ranges, 3 different payer types, 3 different insurance situations, and 3 different clinical needs. And we were able to say, yes, come in, we're gonna help you in this place in a way we haven't been able to do in any other place in Orange County. And so it's not solved it. We got a long way to go, but it's a meaningful step in the right direction, and it's happening only because of this collection of partners that are coming together to do it together. And so that's the cool factor of Be Well Orange County. This is a little video so you can kind of see what the inside looks like. This is not yesterday's hospital. It's designed to be beautiful and dignified and compassionate. If Saddleback built a mental health facility, this is what it would look like. So all of the finishes, we had a whole bunch of people with lived experience, both people who had been patients before and their family members, speak into the finishes and the color schemes and the whole thing. We had a whole bunch of clinicians and patients speak into the paths of travel and the way it feels to walk through the facility. And so it's a lot of high ceilings, tons of windows and natural light, and the whole thing is very, very open. And what I was about to say before the video started, you don't have to do a place that nice, but it absolutely 100% impacts outcomes which is such a normal, like, of course it does. But now there's all these studies that tell us what we already know. The environment that you're in impacts how you feel and how you connect and whether you can decompress and trust things or not. And we watch people who have been living on the streets walk in and step up to the environment they're in and interact with each other and others in a kind of a new and dignified way. Right now, we have people who are struggling with homelessness in this facility. Right now, one of those healthcare executives I told you about, their adult child is here now, and everything in between. We had the child of a state senator here recently. And so this is for the whole community. And we're just about done here. When we're done with this, we'd like to see 3 campuses like that, located north, central, and south county, amidst those mobile vans and with that navigation system so that it functions just like our world-class stroke system in Orange County. We have a world-class mental health system that's available for crises and that we can be really proud of, and that's replicable. Last test. The public and private partners of BYOC remain fully committed to reaching toward each other, to find each other, and to build together a transformational system none of them could do alone. So we disagree and we see things differently and all this stuff, but we are going to keep channeling together to get this accomplished because everybody in this community is deserving of it. And if there was one community that could pull it off, it's Orange County. So thanks for letting me share this with you guys.
Okay, we are going to go a little bit further. I love the sound of conversation. It's so much better than me sitting in my computer in my home office talking to an empty screen for 2 years. So I love to hear your conversation. We're going to talk a little bit further about some of the things that Marshall shared with us. This morning, just in anticipation of this, I went back and looked through my emails to find when this whole thing started, at least from my perspective. So I was invited in March of 2017 to be a part of, I found my email, and it says that thanks for joining in the inaugural convening of the Orange County Coalition for Mental Health. The vision for the core group of leaders is to be the spark that ignites a countywide collaboration, building on the momentum of so many and unified to improve the mental, emotional, and spiritual health of our community. So the needs facing Orange County today call us to embrace a whole person, whole community, whole systems view and discover creative ways to serve together. Collectively, our opportunity is to grow a boundary-crossing, distributed force of leaders who are emboldened by aligned vision and diverse yet complementary in assets and actions. And the whole thing was just to talk about how do we create in Orange County a system of care that is world-class. And I have to tell you, it was 4 years, 2017, it had been 4 years since Matthew had taken his life, and I was still angry and disgusted and frustrated by our experience of trying to get mental health care for Matthew. In fact, some of you have heard me say, to get mental health care for him, I took him out of Orange County because I couldn't find what I needed here, to be hospitalized. I was like, I don't want him hospitalized here. I will pay, and I had the ability to pay out of pocket for some care that I thought was better in other places. And it used to drive me crazy. It was like, this is wrong. I have lived in Orange County at that point. I'd lived in Orange County like 38 years. I'm like, I've lived here for most of my adult life. This is an amazing place. Why should I have to go to another county to get mental health care for my son? This is wrong. This is wrong. And so that, I guess I'd made enough noise that I got invited to this inaugural meeting, and I felt very much like a fish out of water because there were healthcare systems and insurance companies and the county, and I'm just like, hey, I'm just a mom who lost a child to mental illness, and I don't really know what I can bring to this other than I'm mad and I'm sad, and I'm kind of standing up saying this is not okay and we can do better than this. And so to get to be a part of watching what has happened, and then I found just a year later, I was just showing this to Marshall, so just a year later after that inaugural thing of saying, hey, it's this Orange County Coalition, blah, 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 we even called ourselves the Coalition of the Willing. Do you remember that? We kind of coined that. It's like we don't even really know what we're doing or what this means, but we are willing and we are going to join together and we're going to bring what we have. So a year later, then I found we had identified a name. This thing shall be called Orange, Be Well, Orange County. The goal is to provide the best mental health and wellness for all in Orange County, all who live in Orange County, from children to the elderly, to ensure the best wraparound services for mental health and substance use disorders, regardless of insurance provider. And then it lists all the representatives, and what had started as like 35 people was now up at around 100. And to see that what has developed in this amount of time just gives me such joy and such pleasure. So thank you, Marshall, for being such an integral part of making it all happen.
Do you remember how and why we came to branding it instead of just calling it Coalition of the Willing?
No, remind me.
So I'll keep it short, but you should know. The reason is sitting right next to me. So we were, Kay and Joy were invited by the mayor of New York City and the mayor's wife to go out and learn about Thrive New York.
Yes.
You remember?
Yes.
And you were so gracious to allow me to join you.
Yes.
And so we went out and met with the mayor's wife and learned about Thrive
Yep.
New York City.
Yep.
This huge thing going across all of New York City. And so we spent a couple of days there, and at the end of it, we were sitting, you and Joy and me, just kind of talking about what we had experienced, and we were saying, you know what? They're not that much farther down the field than we are, but they've branded this thing Thrive, and the whole community has something to hold on to. And so we came back and said,
Be
we should
Well.
call the Coalition of the Willing something, and we ended up calling it Be Well
Be Well.
Orange County.
Okay,
Yeah.
well, there you
Oh,
go.
that was that trip?
Yes, I remember
Yeah.
that now. So I just want to take a few, and we have some of the questions that some of you asked, but you have worked with a lot of people who are in mental health crisis. What have you seen to be the most helpful for family members to support their loved ones in crisis? Yes, we have the system, but I'm almost thinking more on the emotional level. How can family members support their loved one who is in crisis?
I don't know that I'll have great answers to
That's
all these
okay.
questions, but this one I have a couple of good answers for. And so Saddleback Church is an example of what do loved ones do and where do loved ones go. This, to me, is an ideal setting of faith community making itself available to one another to be supportive. And so there are other churches and synagogues and organizations around Orange County that are starting to model after Saddleback, and I think that is an ideal place for family members to get support. There is another one, and the head of it is sitting in the back of the room, and his name is Steve Pittman. And Steve, for a long time...
Woohoo, we love Steve.
Yep.
Raise your hand, hi, stand up, there you go.
So a lot of you guys know Steve Pittman and are familiar with NAMI, Orange County. And so NAMI has been on the front lines of that work since forever. And when mental health was still a very peripheral thing to healthcare, we're finding our moment now, but for a long time it was invisible, and the leaders of NAMI were making it happen. And so the NAMI to NAMI family group, family to family, is about as good a support system as I know. And I would highly recommend going on NAMI Orange County's website to learn more about what they offer.
Yeah, absolutely. So someone even asked me today, it's kind of a spin-off of that question, which is, how do I get my loved one to get care when they don't really think that they're ill or they don't recognize how ill they are? That question comes up every single conversation I have with a family member.
Yep.
That is the perennial question. So
Yep.
what would you say if I were saying that to you? I would say my loved one just doesn't recognize that he needs help. What do I do?
Yeah, it's so challenging. Just kind of to empathize for a quick minute and then talk about solution. So we were talking at the start of my sharing with you about other healthcare conditions, and so cancer and diabetes and these other things. When those illnesses come up, the person struggling is usually the first at the front of the line of, hey, this is going on, let's get me to good care. There is a willingness and an eagerness to get support. It is such a mind-boggling and heart-wrenching reality that with substance use disorders and mental illnesses, oftentimes the person struggling is the last to be able to see it or to want care. So I just want to empathize for a minute with family members who may be struggling through that. You're not alone in that, and it's extremely difficult. When families call me, like the two I shared with you, one of the first things I want to recommend to them, this is how this links to that first question, is getting help for themselves is so critical. So I have an older daughter at home who struggles with anxiety and some other things. I do what I do for a living. My wife is a school psychologist, and we're like the Three Stooges, but there's only two of us. But we trip like three of us over her situation and how to get help. And we're professionals in the field. It's really hard when it's a loved one, especially a child that's so close to you. And so getting your own support is critical. So that's where ANAMI comes in. That's where a community like this comes in, because it's never going to be a journey that's from here to solution. It goes up, it goes back, it goes forward, it goes down, and you need somebody tethered to you to help guide you through. A good therapist is also useful, and so getting your own counselor or therapist.
And I would add to that, we talked, if you missed last month, we talked about the new support groups that we have at Saddleback. Not only the family to family, the NAMI family to family class, but also there's a support group for loved ones, and then a support group for people living with mental health challenges. So I 100% agree with you, Marshall, that yes, you may or may not be able to help your loved one understand that they need help, and may or may not be able to get them into the treatment that they need, but you can take care of yourself. And one of the best ways is through a support group. You can sign up for them. We'll talk about that, at the very end, but you can sign up to be a part of a support group. They're online and in person, finally, again. So getting that support for yourself is incredibly important. So what about if, and I want to also add, you may have seen this on our resource table. There's a book back there called I'm Not Sick, I Don't Need Help. We recommend it all the time, because if you have a loved one who particularly does not recognize that they are living with mental health challenges and get offended that you bring it up, or are just so tired of you trying to get them on treatment or trying to get them to take their medication, and you're having all this conflict, and it's just this, this circus day in and day out, then it might be helpful to get the book that's on the back there. It's called I'm Not Sick, I Don't Need Help, by Dr. Javier Amador, because he just helps loved ones learn a different kind of language to be able to talk with your loved one. It could be a parent. It doesn't necessarily have to be a child. I mean, you could be here as it's your parent that has the mental illness and doesn't see it. But the whole idea of just learning how to change your language to be able to communicate and get on the same page together, I highly recommend that. So Marshall, let's talk about substance abuse because you definitely have a background in helping people with substance use disorders. So how would you we've been talking about, mental health challenges, but now translate that, if you will, to substance use disorders, and what help is there available, and how to have families work with their loved ones with substance abuse disorder?
It's kind of the same answer, and it's kind of the same dynamic. And so Al-Anon is a tremendous organization. Some of you are familiar. It's the AA for the family. We have an Al-Anon group every Wednesday night at the campus in Orange that I showed you, but you can also find Al-Anon online, and there's groups all over the place. Paul Gillane is one of the best family therapists for substance use that I know in the country, and he's here in Mission Viejo.
You want to say that name again?
Yeah, Paul Gillane, Gillane, and he does groups as well as individual family support. But in the same way that we just talked about with mental health, with substance use, I underscore for families the critical importance of getting themselves into care, because with substance use, the dynamic is so easy to see that this is my son, my wife, my daughter's problem, not mine. They need care. Well, that may be true, but it's hard for the family to see. They may not have done anything wrong to cause it, but they can't avoid being part of the system. And so for families, we'll highlight, you remember the little mobiles that you hang above a baby's crib and you push one and it impacts all of them? Like, it doesn't matter what you've done or not done, you're part of it. And so recovery requires the family's participation, and that's often harder to hear for the family. And so really pushing on that. Counselor, Al-Anon, NAMI can be helpful in that diagnostic category as well, but the family's got to get care.
Yeah, and of course, what's our answer here at Saddleback?
Oh, celebrate recovery.
Yes, celebrate
Yeah, of course.
recovery.
Yeah,
but,
of course.
Yes, but
Yeah.
just that faith, to add the component of
Thank you,
faith
yeah.
to that. That's okay. We don't
Yeah.
expect you to remember all of our programs, but we
No, it's an
absolutely.
excellent one.
Yeah, it
and
absolutely
it's far and wide, too. We just met someone from New Jersey who is part of CR in New Jersey. So, yeah, awesome.
So Celebrate Recovery, not just, and one of the best things about Celebrate Recovery that I think in the last few years that has just been, like every other organization, is growing and recognizing how mental health challenges interplay with what happens in Celebrate Recovery. And so you can definitely bring your mental health challenges to Celebrate Recovery and know that the people that you encounter there are going to understand that, and the two can go very well together and get the help that you need. So let's talk about maybe let's talk a little bit about Be Well. So what would be the process if somebody has heard this and just thought, that's amazing, how do I get connected at Be Well? If I have a loved one or myself, what's the process right now?
And so there is a website you can go to, which is beweloc.org, and you can find out a lot there. I want to add some qualification to the question, though, too. And so Be Well is more than the campus and more than that mobile program. And so we're really proud of that campus and what it's doing. And we're also, there's no illusion about what that is with respect to the need. And so that is a new treatment facility done in this extraordinary partnership and doing a lot of good things for a lot of people. And if your family member is in a crisis and we can care for you or them there, we want to. And it is a step in the right direction. We've got a ton of more work to do, and it's a facility for acute needs. And so the mobile program is another way that we're expressing care of getting out into community. Right now, it's limited to Huntington Beach and Garden Grove and Anaheim and the cities I named, hopefully spreading. The larger part of Be Well, we actually need you. Because that is trying to create this larger unified system where we have mental health being expressed through schools, through churches, through the YMCA, through all of the things that you guys are a part of. And so when you visit the website, if you're in need of care, you will find some phone numbers to access care. But you'll also find descriptions of a bunch of other initiatives and ways to volunteer, and we would love to recruit you into that. There is, I'll keep it short, there's a little network being created right now around children's trauma. And so we have, I think, 40 different organizations, from law enforcement to hospitals to schools to any number of mental health clinics, and they're all coming together in a way they've never been connected, so that when a child is identified who's had a traumatic experience, they get plugged into this unified group of community, not just bounced around. That's an expression of Be Well beyond the campus that we need all of you to participate in. So.
Well, and just so I want to come back to, you mentioned volunteers and ways that maybe other people could help or participate, but would you give us just maybe a brief overview of the next campus that's in process and what the update is on, because like you said, it's not just one, you're looking for three.
We need at least three, and one proxy for three is that 50,000 ER admits. So what would it take to get 50,000 people better care? And if each of these campuses can treat about 15,000 people a year, and we had three of them north, central, and south, we could put a real material dent in that. That's just one little proxy measure. The first campus that you saw in orange is 60,000 square feet, and it's 7 services. So good, a respectable start. But we're looking next at a South County location that would allow us to do something in multiples in size. And so where we could have a full continuum of child and adolescent care, we could have a full continuum of senior care, outpatient access, and just really take it to the next level. So we're working on that now, details to come,
Okay.
But South County is the focus.
So if somebody wanted to volunteer, are there ways to volunteer at the Be Well campus?
There
or just
are.
those? Okay.
Yeah, there
Love to
there
hear
are.
that.
And on the website is the best, well, on the website is the second best description. The first best is Christy in the back of the room.
Christy, just stand up. So,
Hi, Christy.
yeah. All the way up. Yep. Woohoo.
That's the first best way to connect and volunteer.
Yeah.
And it's really awesome. And so the volunteer group has created their own kind of brand around themselves called the Ambassadors of Hope. And it's so awesome. We've got people of all age ranges volunteering at the campus, and their work spills out into community. And so for suicide prevention, they're hosting community events. We need volunteers for that. And there's just a ton of stuff to do.
So somebody said, what do I do if I don't have insurance? So, you know, how difficult it is to get care without insurance. And Be
Yeah.
Well's trying to address that.
We are, yeah. So the question is, what do I do if I don't have insurance? If you don't have insurance and you are in need of acute care, Be Well, the campus in Orange, could be a solution for you. I would also really highly recommend you contact OC Links, which is the county's navigation line. And somebody at OC Links would be able to take you in and walk you through the process of how you get onto an insurance plan. And so you might meet the qualifications for a Medicaid plan through, in Orange County, it's called CalOptima, or you might qualify for an exchange plan. So there are solutions, but the first and best contact would be OC Links to start walking you through that. Gosh, I'm sorry, I don't know if it's a .com or not, but I bet you if you Google OC Links,
Joy or
it'll come
Lauren
up.
will find that for us in
Yeah.
about 2 seconds
it
flat
might
here.
be a .org, I don't know. But it's run by the Orange County Healthcare Agency.
Yep. No pressure. No pressure. I feel like I'm not going to say. What, Joy? Yeah, I was thinking it was .org, but I didn't want to say it.
I do Google it.
Yeah.
OC Links.
LINKS.
And say mental health support line, and it will come up. You know, as critical as I am of the lack of a system, I will put a compliment out. The County of Orange, our public sector entity, does some really good things for the people that are uninsured in getting them insured and creating access to mental health support. It's not perfect, and some of you have lived it and maybe have had some not so perfect moments, but they do work hard to try to create that capacity.
So did we figure that out? We're not sure. Google it. You can find it. So, Marshall, let me just close with this. Just, you know, you are a pretty optimistic guy. So what's your hope, though, for the future of mental health care in Orange County? From 2017,
Yeah.
you know, we're looking like 5 years later, and we've come so far with that moonshot of the best mental health care for every Orange County resident.
Yeah.
But what are you most hopeful about in these 5 years?
I am super sincerely hopeful that Orange County is on a path to moving the dial. And so, did I tell you that Javier Becerra came? So the Health and Human Services Secretary for Joe Biden, he's the top healthcare guy in the country, came to visit Orange County to see Be Well. And the whole county supervisors of Sacramento are coming down in 2 weeks to visit us. We have a ton of more work to do, and we stumble and fall on our face every day. But Orange County really is poised through this partnership called Be Well to do something significant and create a model in Orange County. So a quick call out. I really mean thank you to UK for your leadership. And so you know Kay's humility and modesty, and so she showed up as a mom at that meeting. But if there was one person that caused everyone to perk up and be at attention, it was Kay and the sincerity of her experience. And we have leaders across Orange County of Kay's caliber who are stepping up and saying, this has to happen. And so the County Board of Supervisors are leaning into this thing. All of the CEOs of the major hospitals are leaning in. The chiefs of police and Don Barnes are leaning in. It's extraordinary. And so I'm hopeful that the leaders of Orange County and the community that's rallying them are going to continue to move this forward, and we will flesh out that system that I showed you on a piece of paper and live it. We're 3.2 million people. We're the 6th largest county in the country, and at the same time, we kind of feel still like small town in some way. We can wrap our arms around this and pull it off. And so this is going to happen.
Yeah.
Yeah.
So would you join me in thanking Marshall?
Okay, thanks, Kay.
So as we close today, just to, whoop. That's what happens when you wear a train, you know? You drag things behind you. Thanks, Marshall, so much. So next month, as we said, Mylan and Kay Yurkovich are going to be speaking. They're going to be talking about conflict in relationships and how that affects how we handle the mental health crises that happen in our homes and our families. I love when they talk, so they'll be here on June 26th. If you are interested in being a part of a support group, you can talk to Christy, again, in the blue sweater, hand up. Celebrate Recovery. You can sign up if you need prayer. Our prayer team is ready to pray and encourage you, and we're just so glad. Did I leave out anything, Joy or Lauren, that you would?
The OC Links website is ochealthinfo.org. So if you're looking for that, or you can just type it in Google for OC Links. But yeah, other than that, we're good.
Okay, so let me just pray for us. I'm so glad that you were here this week. It's this month. Awesome to be together. Stay around, talk, have another piece of candy, get some hugs, and we'll see you in June. Father, thank you for this amazing group of people who come burdened in their own hearts with the challenges that they or their loved ones face. God, we all stand here before you, people desperately in need of your breath in our lungs, your love in our hearts, your control in our minds. You have placed us here at this particular moment in time, and I thank you for the encouragement we've heard today. Thank you for the way that Joy and Mike shared their stories, the hope that you've given to them. Thank you for Marshall and the work that he and hundreds of other individuals have already put together to make Orange County a better, safer, more equitable place for people living with mental health challenges. We are just so thrilled to be back together, to have the ability to hug and hear each other's voices, and to just to pat somebody on the shoulder, to look somebody in the eye. What a privilege. I don't know that we'll ever take that for granted again. You're so good to allow us just to be next to each other and sharing in our physical presence with each other, our heartaches, our struggles, our hopes, and our dreams. You hear them, you know the things that we don't know how to verbalize, the things that we don't know how to say, even with feelings lists. We don't always know how to say what's in our hearts. But you hear it. And what an incredible reminder to know that nothing can ever, ever, ever separate us from your love. May that be what we leave today, more reassured than we came in, that we're not alone, that your kindness and your goodness and your presence follow us all the days of our lives. And there is a group of people where we can tell our stories, we can share ourselves and find encouragement to get back out and live our lives coming from this place of safety and acceptance and warmth and goodness and kindness. I pray a blessing on these, my brothers and sisters, until we meet again in a month. In Jesus' name I pray, amen. Love you all.